Interosseous infusion, also known as IO infusion. IO infusion is used on pre-arrest or cardiac arrest pediatric patients under the age of 12 where an IV access is unobtainable. This demonstration will show the Jamshidi IO needle and pressure infuser. Some services are using other devices such as the Cook IO needle. First, lay out all the equipment you will need to perform this skill. This includes the IV solution bag with pressure infuser, selecting an age-appropriate IO needle, 18 gauge for under 1 and 15 gauge for greater than or equal to 1, a primed saline lock with sterile saline-filled 10 cc syringe, an alcohol swab, and the materials to secure the IO after patency has been confirmed. Next, select and landmark the desired insertion site. This should be 1 to 2 finger widths slightly medial to the proximal end of the tibial tuberosity below the epiphyseal plate along the flatter portion of the tibia. Prepare this area with an alcohol swab. Grasp the IO with your dominant hand and insert the IO at a 90-degree angle to the tibial surface. You may need to use a twisting motion to bore through the bone. Continue inserting until you feel a perceptible relief in resistance, indicating that you've pierced into the interosseous space. Stop advancing the IO and rotate the exterior flange down against the skin surface to hold the needle tip at the IO level where you lost resistance. This will help to stabilize but not secure the IO in what should be a position of patency. Remove the cap of the Jamshidi, then remove and dispose the needle. To confirm patency and placement, attach a saline-filled syringe with or without the saline lock and aspirate for bone marrow or air. The lack of marrow does not necessarily mean that the line is not patent. Continue to infuse the saline while holding the patient's leg, feeling for swelling or temperature cooling suggestive of an interstitial IO placement. If the IO is properly placed, you should be able to infuse the saline from the syringe with little or no resistance. Attach IV tubing and inflate the pressure infuser to 300 psi. Lastly, secure the IO with bolsters and tape. These lines are difficult to secure and easily dislodged, so ensure it is well secured and constantly monitored once it is in place.